Dr. Legato, what do we mean by the golden hour of a heart attack?
I think it's quick reporting to experts.
You're going to have one, have it in the hospital.
Have it as close to your doctor and the hospital as you can.
There's something important for everyone to understand. Believe it or not, with our advanced healthcare system, only 35% of patients that present to a hospital with a heart attack are going to the cath lab and getting the artery opened within 90 minutes. And we've actually launched in the American College of Cardiology a national initiative. We want at least 75% of patients to have what we call a door-to-balloon time. From the door of the hospital to the ballooning open of that artery, we want it to be less than 90 minutes in 75% of patients.
And in all cases, if you're having unusual pain, go to the hospital.
Absolutely.
Don't monkey around. You got chest pain, it's a sign of something.
Embarrassment is no place near
That's
as
right.
bad as death.
But I would say even more importantly, it's not just chest pain. It's abdominal discomfort that doesn't go away. It's sweatiness, it's nausea, it's all of those things that we need to get the word out about.
Something that always has worried me is that people will drive themselves to the hospital. It's important when you have those symptoms to call 911. And let me tell you why. If the heart rhythm disturbance occurs and that ambulance crew is on the site, they can give you a shock and they can restore the heart rhythm. We have defibrillators now on the walls in airports and in banks and other kinds of places, and people should learn about that. You can really save a life by defibrillating someone who's had a heart attack, whose heart has stopped, and save them right there on the spot. And bystander CPR is very important.
Dr. Roizen, what about aspirin?
You know, it is absolutely wonderful. Two baby aspirin or half a regular aspirin decreases risk of heart attack and stroke. It's different in men and women a little bit, but it's the same overall by about 36%. So it's really important, but don't do it because we're saying so, because you should see your doctor before you do any of these things, because there is some risk with aspirin.
We have to be a little bit careful here, Larry, and that is that if you had a heart attack, aspirin is mandatory. But only those individuals that are at high risk for a first heart attack benefit from taking aspirin prophylactically. So that's why Dr. Roizen says see your doctor. It's not right for everybody.
But it is a blood thinner, right? And
It's a
you
blood
want thinner blood.
You want thinner blood, but there are risks associated with that. And the current labeling of aspirin by the FDA is for use after a heart attack, but not clearly in everyone before the first heart attack.
I knew a cardiologist years ago. He thought that every American, male and female over the age of 40, should take a baby aspirin every day.
Well, that's a good point, because years ago we didn't have any studies in women to look at that, but 2 years ago studies from the Women's Health Study were presented, and in fact aspirin is not helpful in women who are under the age of 65 for prevention. It's helpful if you've had a heart attack, but not if you haven't. So it is important to talk with your doctor about it, because newer data are pretty convincing.
Dr. Roizen, sudden cardiac death. I think it's about 500,000 people die of it. Whack, gone, no
Well,
is that preventable?
Well, they've all got symptoms beforehand, or signs, most of them. That is, they've had high blood pressure, or they smoke, or they have abnormal lipids, or they have diabetes, or one of the other things, or they eat horrible food, or they don't have normal sex patterns. So they have things beforehand that should alert them. But from the time of onset of the acute event, for that first hour, roughly 30% of people with a heart attack die. So you were lucky. You survived, and you lived to be able to change not only your health, but a lot of other people's health through the foundation.